our health screenings, blood pressure is measured after we perform the finger stick. The same team member performs the finger stick and the blood pressure of the participant. Now that I've completed the finger stick, we're going to go ahead and check your blood pressure. So if I could just get you to make sure your back is flat against your chair, sit up nice and tall, and also just keep your feet flat on the ground for me. Position the arm so that it is resting on the table at heart level, slightly flexed with the palm facing up. The arm should be bare. If the participant has a long sleeve on, they can loosely roll it up, but ensure it does not get too tight around the upper arm. If there is no way to roll up the sleeve, palpate at the artery to see if you can feel a pulse through the clothing. If you can feel the pulse, there is a chance you will be able to hear one through the stethoscope. It is important that the participant is relaxed, sitting upright, legs uncrossed, feet flat, and arms supported. If any of these parameters are not followed, there is a margin for error with the blood pressure reading. Next step in ensuring accuracy of the blood pressure reading is to select the appropriate sized cuff. Each station will have two cuffs, one regular adult and one large adult. The cuff should encircle at least 80% of the arm. The cuffs have range lines that should be used to determine the appropriate sized cuff. Place the deflated cuff snugly but not tightly around the upper arm, about 1 inch above the crease in the elbow, centering the bladder over the brachial artery. Most cuffs have an artery marker, which helps with the appropriate placement. Place the stethoscope over the artery below the cuff. You can always find the pulse in the artery to help with the placement if needed. Close the valve by turning clockwise. Squeeze the bulb to inflate the cuff until it compresses the artery tightly enough to momentarily stop the blood flow. This is usually 30 millimeters of mercury above the participant's resting systolic pressure, or around 180 millimeters of mercury if pressure is unknown. In a slow, controlled manner, release the air in the cuff by opening the valve, turning it counterclockwise. Continue to deflate the cuff at about 2 to 3 millimeters of mercury per second. Listen closely through the stethoscope and watch the gauge on the cuff. The number at which the first sound or pulse appears will be the systolic pressure. Keep listening carefully. The pulse will continue to become dulled and finally disappear. If you are hearing the pulse immediately upon beginning to deflate the cuff, this indicates that the systolic pressure is above 180. In this case, completely deflate the cuff and start over, this time inflating the cuff to around 210 millimeters of mercury. The last number at which you hear the pulse before it disappears is the diastolic pressure. Once you have both the systolic and diastolic pressure, deflate the cuff the rest of the way and carefully remove the cuff from the participant's arm. I'm just going to go ahead and write your results down that we got for you today.
That seems a little high for my blood pressure.
Have you ever had your blood pressure checked at work before?
I guess not, no.
Sometimes our blood pressure can be a little bit higher at work due to caffeine, just being under stressful circumstances, things along those lines.
Okay.
But a health coach will actually be able to go over your results with you in just a little bit and answer any questions that you may have.
Okay, thank you.
Give the results page with all values recorded on it to the participant and let them know where their next step is. Please note, it is very important to take into consideration that the adult large cuff may not fit certain participants. In these situations, we will take reading of their blood pressure by using the forearm blood pressure technique as follows. Clients may be sensitive to their size. Utilizing this procedure in a calm and matter-of-fact manner will help them stay relaxed. The client should be relaxed and squarely seated with legs uncrossed and back resting against the chair. Forearms supported at heart level, utilizing a glove box or similar item for support if needed. All clothing covering the cuff location should be removed. Rolled up sleeves, if tight, may create a tourniquet effect above the cuff. If unable to remove, clothing should be checked for thickness. If the pulse can be palpated, then the cuff may be placed over the clothing. The client should be kindly requested to not talk during the procedure, as this may make it more difficult to hear the heartbeats. When using the forearm, position the cuff midway between the elbow and the wrist. Palpate to find the radial pulse, then position the cuff so that the artery mark is in line with the pulse. Place the stethoscope where you have found the radial pulse, at the pulse point. The cuff should be inflated to at least 30 millimeters of mercury above the point at which the radial pulse disappears. The cuff should then be deflated at a rate of 2 to 4 millimeters of mercury per second. Listen more acutely, as the pulse may have a quieter sound being further away from the heart. Just like performing a finger stick, measuring blood pressure takes good listening and practice. A few more health designs best practices to keep in mind when measuring blood pressure are as follows. If you did not get a reading upon your first blood pressure check of the participant, completely deflate the cuff, take it off, and try again on the other arm. We usually check the blood pressure of the arm that is closest to the table. Some participants require or prefer it to be checked on a certain arm. We respect and accommodate the request of the participants. For instance, a participant who has breast cancer and has had surgery or suffered damage to the lymph nodes may need to avoid having their blood pressure taken on a certain arm. This is due to an increased risk in lymphedema, an accumulation of lymphatic fluid that could cause swelling in the arm of the surgical side. If you get a reading of 160 over 100 with either the systolic or diastolic or both values, this is a critical value. Please be discreet and mindful of privacy and ask another experienced HD team member to recheck the blood pressure. Record both readings on the results sheet. We will take the lower of the two readings to record on the personal health assessment. Avoid discussing the results at the station and ensure the participant that they will have an opportunity to meet with a health coach and therefore have any questions answered in a more private area. Because we are measuring blood pressure manually and our dials display even number increments, our readings should only contain even numbers. For example, 124 over 84, not 123 over 83.